Most of the surgical options that we employ are done vaginally. Now, in order to break this down, I think we have to discuss it in terms of organs. If the uterus is prolapsing, then it can either be removed or suspended. I think that's a topic that would be left for a face-to-face discussion, but the option to retain the uterus remains. There are some women whose prolapse is so significant that it just doesn't make sense to leave the uterus in place. When the bladder prolapses, we can return it to its normal position by either suturing your own tissue and creating a support that has been lost, or we can use other types of tissues in order to create that support if we feel that your own tissues are just not good enough to provide long-term support for you. Those other tissues can either be synthetic material or biologic material. Synthetic material simply is that, and it lasts forever. The problem with it is that there may be some risks associated with it that we will discuss a little later. The biologic material is safer to use, but may not have the long-term efficacy. So if you are a younger woman, then I think you need to consider both options and weigh the risks and benefits. That's something that we will do in a face-to-face nature. When the rectum is prolapsing, again, we can either use your own tissue to create a stronger wall between the rectum and the vagina so that that bulge gets reduced. But if there is no good tissue to use, then oftentimes we will employ a piece of biologic material and just place it over the defect and sew the vagina over it. That's called a posterior colporrhaphy, and it's a very common procedure. It's also considered to be outpatient. Most of these things can be done on an outpatient basis. At the very most, you'd be required to remain in the hospital for one night.